If you are on a blood pressure medication right now, there is a symptom your body may already be showing you that you have completely misread, and by the end of this video, you will never look at that symptom the same way again. Every single day, millions of people swallow a small pill for high blood pressure without ever being told what that pill is actually capable of doing to the rest of their body. Not because anyone is hiding it from them on purpose, but because a 15-minute appointment is never enough time to explain 11 different things that can happen once that medication enters your bloodstream. So people leave with a bottle, a number to bring down, and almost no real understanding of what comes next. And that gap, that silence between prescription and understanding, is exactly where people get hurt. This is not about scaring you off your medication. Blood pressure medication saves lives every single day, and stopping it without guidance is dangerous in its own right. This is about closing the gap nobody closes for you, because once you understand what your specific medication is doing inside your body, you stop being blindsided by your own symptoms, and you start catching problems while they are still small and manageable instead of finding out the hard way. So stay with me, because by the time we reach the end, you are going to know exactly what to watch for, what to ignore, and what should make you pick up the phone immediately. No guesswork required. Let's start with something almost nobody explains clearly enough. 3 of the most commonly prescribed blood pressure medications, a calcium channel blocker, an ARB, and an ACE inhibitor, are treated by most patients as if they are interchangeable. They are not. They lower blood pressure through completely different mechanisms, which means they create completely different side effect patterns. If you don't know which category your medication falls into, you cannot correctly interpret what your body is telling you. A calcium channel blocker relaxes the walls of your blood vessels. An ACE inhibitor blocks a hormone pathway that narrows vessels and manages fluid. An ARB works on a similar pathway but through a different receptor. Same destination, 3 completely different roads, and 3 completely different sets of warning lights. This matters more than most people realize, because if you assume all blood pressure medications behave the same way, you will misdiagnose your own symptoms every time. You might think a side effect from one drug applies to all blood pressure medicine, panic unnecessarily, or dismiss something that actually deserves attention. Keep this idea in your mind as we go through every point ahead, because the name on your bottle tells you the category, and the category tells you exactly what to expect. Number 11, the swelling that people blame on everything except the actual cause. Calcium channel blockers are notorious for causing swelling in the ankles and lower legs. This happens because these medications relax the small arteries more than they relax the veins. Blood flows into the legs more easily than it drains back out, pressure builds in the smallest vessels, and fluid slowly seeps into the surrounding tissue. This is why so many people notice their shoes fitting fine in the morning and feeling tight by evening, or their socks leaving deep marks on their skin by nightfall. Most people blame salt intake, weight gain, or weak circulation before they ever consider the pill they took that morning. If this sounds familiar, don't panic, but don't ignore it either. This is exactly the kind of symptom that needs to be reported, not silently endured. Number 10 builds directly on that same idea, because untreated swelling doesn't just sit quietly in the background. Left unaddressed, it can become uncomfortable enough that people start skipping doses just to avoid how their legs look and feel, which then allows blood pressure to creep back up completely unmonitored. A side effect that seems minor on its own can quietly sabotage the entire treatment plan if it isn't discussed openly. The fix is rarely stopping the medication altogether. It's usually a conversation, a dose adjustment, or a simple addition to the treatment plan. But that conversation only happens if you speak up. Number 9 is the cough that convinces people they are getting sick, catching allergies, or developing acid reflux, when the real explanation has been sitting in their pill organizer the entire time. ACE inhibitors are well known for causing a dry, scratchy, persistent cough that isn't wet or productive, just relentless. What makes this especially tricky is the timing. This cough doesn't always start immediately. It can appear days after starting the medication, weeks later, or even months down the road, which is exactly why so many people never connect the dots. They blame dust, dry air, a lingering cold, or seasonal allergies instead. If you've started a new cough since beginning this type of medication, even if it took a while to show up, that timeline matters far more than people assume. And this leads directly into something you need to hear clearly, because there is a version of this side effect that is not annoying. It's an emergency. A dry cough alone is a nuisance, but swelling of the lips, tongue, face, or throat, especially if breathing or swallowing becomes difficult, is not something you wait out. That is not a Monday appointment. That is emergency care immediately. ACE inhibitors carry a rare but serious risk of this kind of reaction, and ARBs carry a smaller version of that same risk. Cough, pay attention and mention it at your next visit. Throat or facial swelling, act immediately. Keep those two completely separate in your mind. Number 8 hides in a place most people would never think to look: the grocery store. If you're on an ARB or an ACE inhibitor, potassium becomes something you actually need to track, and not just through supplements. Potassium shows up in salt substitutes, heart-healthy seasoning blends, electrolyte powders, and even some meal replacement drinks, products people reach for specifically because they think they're making a healthier choice. Both of these medication classes can raise potassium levels in your blood, and high potassium can interfere with your heart's electrical rhythm. It doesn't always announce itself with something dramatic. Sometimes it shows up as muscle weakness, cramping, tingling, fatigue, or a fluttering, irregular heartbeat. If you've recently switched to a salt substitute or started using electrolyte products while on one of these medications, that combination deserves a second look. Not fear, just attention. Number 7 is the lab result that convinces perfectly compliant patients to quietly stop a medication that may actually be protecting them. ARBs and ACE inhibitors don't just lower blood pressure. In the right circumstances, they help protect the kidneys and heart over the long term. But when you first start one of these medications, or when the dose increases, blood work may show a small rise in creatinine or a small dip in kidney filtration numbers. To someone reading their own lab report without context, that can look like proof the medication is causing harm. Sometimes a shift like that does need attention, but often a small expected change reflects the medication adjusting pressure dynamics inside the kidney's filtering system, not damage. The number that matters is not just whether it moved, but how much it moved, and what the overall trend looks like over time. This is exactly why lab monitoring isn't an optional extra step. It's part of the treatment itself. Number 6 might be the most overlooked danger of all, especially for older adults, because it isn't about the medication changing, it's about your body changing underneath it. If you come down with vomiting, diarrhea, a stomach bug, poor appetite, or you're sweating heavily in hot weather, the same dose that worked perfectly yesterday can behave very differently today. Blood pressure can drop too low, kidneys can come under sudden stress. You can feel dizzy, weak, or faint. And in some cases, this combination can push someone into acute kidney trouble far faster than expected. The medication hasn't changed, your hydration and internal environment has, and the dose is now acting inside a completely different set of conditions. This is precisely why illness, especially anything involving fluid loss, is never a moment to simply push through your normal routine without checking in. Number 5 is sitting in almost every medicine cabinet in the country, and it rarely gets mentioned as a serious risk because it feels too ordinary to matter. Over-the-counter anti-inflammatory pain relievers, the kind people reach for casually for back pain, knee pain, or a weekend of yard work, can interact seriously with ACE inhibitors and ARBs, especially if a diuretic is also part of your routine. Individually, none of these feel dangerous. A blood pressure pill, a pain reliever, maybe a water pill. But combined, particularly during any period of dehydration, they can reduce blood flow to the kidneys and raise the risk of kidney injury. Most people never think to mention over-the-counter pain relievers to their doctor because they don't even categorize it as real medicine. That blind spot is exactly what makes this interaction so common and so preventable once you know to flag it. Number 4 is the symptom people laugh off until it becomes something far more serious. Dizziness and lightheadedness, especially that woozy feeling when standing up too quickly, are common when starting any of these medications or increasing the dose because your body needs time to adjust to a lower blood pressure. For a younger, more mobile person, that might mean a few uncomfortable seconds. For an older adult, a few seconds of dizziness can end in a fractured wrist, a head injury, or a broken hip. What's especially important to understand is that dizziness isn't always harmless adaptation. Sometimes it's a sign the medication is working a little too aggressively for your current hydration level, your current dose, or your current combination of medications. Mild dizziness that fades after a few days is one thing. Fainting or dizziness that keeps repeating is something else entirely, and it should never be quietly tolerated. Number 3 is where a lot of otherwise careful people accidentally undermine their own treatment. They see one high reading on the monitor and assume the medication has stopped working. They see one low reading and assume it's suddenly too strong. But blood pressure is not a fixed number. It moves constantly based on sleep, stress, posture, caffeine, pain, conversation, and even anxiety about the reading itself. A single number is a snapshot, not a verdict. What actually matters is the pattern over days and weeks, not a single startled glance at the monitor after a rough night's sleep or a rushed morning. Judge your medication by the trend, not by any one moment. And now we arrive at the 2 ideas that tie everything else together. Number 2 is the danger of stopping medication silently. When a side effect becomes uncomfortable enough, a persistent cough, embarrassing swelling, unpredictable dizziness, the instinct for a lot of people is to simply stop taking the pill without telling anyone, hoping the problem quietly resolves itself. What actually happens is far more predictable and far more dangerous. Blood pressure creeps back up unmonitored. The original risks the medication was managing return in full force, and nobody notices until something forces the issue. Silence doesn't make a side effect disappear. It just moves the risk somewhere you can't see it coming. Which brings us to number 1, the truth that matters more than any single blood pressure reading ever could. The best blood pressure medication is not the one that produces the prettiest number for 3 weeks. It's the one you can actually stay on safely, consistently, and honestly. One that fits your body, your other health conditions, your lab results, and your real everyday life. A medication can look perfect on paper while quietly failing in the real world. Because you hate how it makes you feel, you don't understand its warning signs, or you've started avoiding it without telling anyone. One medication might work beautifully for one person and cause miserable swelling in someone else. Another might protect the kidneys wonderfully while a persistent cough wrecks their sleep every night. A third might be a great alternative while still demanding real respect for potassium levels, kidney function, and hydration. None of that makes a medication bad. It makes understanding it non-negotiable. Here's the framework I want you to actually remember and use, because this is the part that protects you long after this video ends. If you're on a calcium channel blocker, watch for ankle swelling, flushing, headaches, dizziness, and that heavy feeling in your legs by evening. If you're on an ACE inhibitor, watch for a persistent dry cough, dizziness, and any swelling of the lips, tongue, or throat. Cough means mention it. Throat or facial swelling means act immediately. If you're on an ARB, watch for dizziness, weakness, illness-related dehydration, and any signs that potassium may be creeping too high, including muscle cramping, tingling, or an irregular heartbeat. With ARBs and ACE inhibitors especially, blood work is not optional. It's part of the treatment. And across all 3, consistency and pattern matter more than any single reading or symptom ever will. One more thing before you go, because this is the part that can genuinely reduce your fear instead of adding to it. Not every side effect is a catastrophe. A mild headache when starting a new medication can improve on its own. Mild dizziness in the first days can settle as your body adjusts. A dry cough can be irritating without ever becoming dangerous. But not every symptom should be endured indefinitely either. And the real skill isn't panicking or minimizing. It's interpreting. The moment you understand which drug class you're on, how it behaves, and where the line sits between this may improve and this is stealing your quality of life, most of the fear around these medications disappears on its own. Because the goal was never to scare you away from a medication that could be protecting your heart, your kidneys, and your life. The goal is to make sure you're never blindsided by your own body again, to make sure the very next time something feels off, you already know exactly what it might mean and exactly what to do about it. If this gave you even one piece of information nobody had explained to you before, share it with someone else taking one of these medications, because the odds are very high that they need this exact same clarity before a symptom they've been ignoring turns into something they can't ignore anymore.